you for tuning in to AP on Play. Our guest today is Dr. Anil Kumar, who some of you may know from his long history in public service. Dr. Kumar, thank you for joining us.
Well, Anjali, thank you so much for having me here. As you know, we talked about it. I have been here a few times with Dr. Prasad for the healthcare conversations, and it's an honor to meet you first time.
Yes, it's so great to have you. And you are currently on the Board of Governors with Wayne State University, which we'll talk about in a few minutes. But why don't you first introduce yourself to our audience? Tell us a little bit about yourself.
Certainly, Anjali. Thank you. So I am a urologist by profession. I came to this country in 1984. At Wayne State University, came as a research assistant or associate, and after that did a few fellowships. I did a residency in urology at Wayne State University, and actually Wayne State University is my American dream, because having come as a researcher, as I was doing my fellowship, I met this wonderful person who was a fourth-year medical student. And so Wayne State not only gave me a research position, gave me my visa, gave me a residency in urology, and also gave me a wife. So we married about 39 years ago, and we have two boys that went to Wayne State. And so now being on the board, I really feel Wayne State is my holistic American dream.
Everything is complete. That's a great story.
Yes, thank you. And so I have been practicing in the northern Oakland suburbs. My office is in Rochester Hills, and also a subsidiary office across St. Joe's in Pontiac. And having practiced there for many years, it kind of hit me that our country spends about $4.3 trillion on healthcare. But our patients, my patients, especially the older ones, did not have money for prescription coverage. So that was not acceptable to me, because if you look at the world around us, say if you look in Europe or India or any other place, when healthcare is covered, prescription drugs are always covered.
Yes.
So what it dawned upon me is that really what we are doing in America is offering diagnostic care. We're not really giving health care, because I'll spend $500,000 of Medicare money to find out what the heck is wrong with the person. And then when I write the script, they say, well, they come back a month later, so how's it doing? And they say, well, Dr. Kumar, I could not afford the medicine, I didn't take it.
Sad.
And so for me, that was a primer for me to rethink what I also should be involved in.
Right.
And since healthcare is federal, I decided I should really run for Congress to make a change. So that's where I ran a couple times for Congress.
You ran, I think, in the 11th District, right?
Yes, 11th District.
2014 and 2016.
That is correct.
And did you run on kind of a healthcare platform?
Yes, healthcare was primary.
Yes.
Education is my next passion.
Yes.
And there is a lot to be changed in both.
Yes.
Healthcare, we need to make sure, because it is not as vocational as it used to be. When I went into healthcare, it was a calling. It was something I wanted to do to help people, at the same time make a good living.
Right.
So it was not totally altruistic in the sense the package comes with good living too. But the amount of satisfaction that you get out of taking care of people, especially when they're ill, is phenomenal. But that is changing, and now more and more corporations are getting into healthcare. More and more patients are numbers rather than patients. And physicians are not given the liberties of practicing as they should,
right,
to monitor the quality of patient care, the quality of care at the hospitals. We used to have a medical staff unit or medical staff quality assurance. We don't have that much anymore. Corporations are buying things according to the cheapest price. So medicine is going into economically based business rather than a healthcare provision. So that's what prompted me to do is to run for education, for healthcare as the primary cause or the primary platform. But education again, we currently 30% of inner city schools and rural schools, kids are coming out of these schools not able to speak English to the level of the education or do math to the level of education. 30% is a big number.
Right.
So when you look at 25 years ahead of us, these are the people who will be our workforce, our teachers, our politicians, our doctors, our lawyers. That again is a vision that is not acceptable to me and to all of us, I'm sure. Mm-hmm. And so we have to make a lot of changes both in healthcare and education. And that's the reason I went out of my comfort zone of being a urologist and trying to see if I can make a difference.
Right. And eventually you segued into the Board of Governors at Wayne State University.
Yes.
So tell us, what is the Board of Governors?
So the board comprises of 8 members. And we have a fantastic board.
Okay, good.
We really do.
Yeah.
We have great members of the board of different vocations. We have an ex-Chief Justice from the Supreme Court. We have a labor union person, 2 physicians, finance person, an activist. So we do, and we work really, really well. We work in conjunction. We have our differences, but we sort them out before, come up to the decision what would be the best for the university. And so these are 8 members.
And these members are elected by the people of Michigan.
That is correct.
And I think that's unusual. In fact, I was reading, it's possible that Michigan's the only state who does this.
I think there are a couple other states, I think so.
Okay, that we
if
have
I remember right, yes.
Our 3 major universities, that's
Yes.
U of M, MSU, and Wayne State University, are basically run by a governing body that are elected by the people.
Statewide election.
Statewide election,
That is
yes.
correct.
Okay.
And that is a great thing because ultimately the board is responsible for oversight, policy, fiscal responsibility, and the well-being of the institutions, because all these 3 institutions have a mission to serve the people. So it's not just academic and business, it is academic and goodwill. And so I have a great pleasure being there, and we have done a lot of good at Wayne State University. As a matter of fact, diversity is tremendous.
Okay.
And of course, there's always scope for improvement.
Yes.
But the one thing that we had last year that we floated is a great thing. It's called the Michigan Promise, which really enables any family whose income is less than $70,000, their kids can go to Wayne State for free.
Was this a new initiative?
And a year ago or so.
Oh,
Yes,
wow.
yes. And so, and I'm
Wow.
surprised that a lot of people don't know about it.
No.
And that's a good platform for me to say, you need to look into it. People
Yeah.
need to absolutely look into it. And we are increasing our numbers of minorities in enrollment, medical school, law school, and in general. We are very proud of a number of things, as I probably was talking to you earlier. We have the first woman president at our university.
Yes, that's
In
Kimberly
100
Espy.
Yes, Dr. Kimberly Espy.
Okay.
And this is 150 years of Wayne State University history. And she's absolutely phenomenal, fabulous, great person to work with. And I think she's going to take this university to great levels.
Let's circle back to the Michigan Promise, because we have a great audience, and I don't know who knows about this and who doesn't. So tell me, how did this initiative get started? Did you have to vote on it? How did it come to be?
Well, yes, we did vote on it, and the governor of Michigan, Gretchen Whitmer, was involved with it. So we have some finances from the state, from our donors, and so that is how it has come into to happening or being. But it is a great thing for people to know and make use of.
Right.
Because I know a lot of, I practice in the northern suburbs, so Pontiac is another great city which has a lot of minority kids. So does Warren in the Macomb area. And we need to let these kids know that, or their parents know that this is a possibility and we should avail of it.
And so that is if your household income is less than 70,000. Wayne State University essentially will subsidize your tuition.
Education for
Yeah.
free.
How much is the tuition at Wayne State?
That's a question. Now, being on the board, it's a difficult question for me.
Yes,
to answer.
I'm sure. Well, do
But
you guys?
I don't know how much
Okay.
it is because, again, tuition is different for medical school, law school, and in general undergraduate. But it is in the middle of all
I think-
similarly placed universities.
Well, I can tell you, University of Michigan is about 50,000 room and board per year.
Right, that's much higher than at State
Yes,
University.
yes, yeah.
And U of M is in a different category.
Right, yeah.
We are the middle group, which is like Michigan State and others will come into that.
Right.
And I really don't remember the right number, but we can get that for you.
How do you? Does the Board of Governors set tuition, or how does tuition get set? Okay.
The tuition does not get set, but we do monitor the increment in tuition per year.
Okay.
So it's already been set.
Yes.
And then we decide if we need to increase or not.
Yes. Okay.
The state allows a percentage of increase every year, and then we try to figure out what percentage should we go at. We try to balance between our fiscal responsibility. After all, we have to run a university.
Sure.
And how much of aid that our students who cannot afford have. So we do not, by the increment in the tuition, we make sure that those that are not so privileged will still continue to give grants, scholarships, and others so that their education is not altered.
Right.
So we balance it. That's our function.
Yes. Tell us. So you've been on the board since 2018.
Yes.
What are some of the other issues the board has had to face, vote on, initiatives, et cetera, in the last couple of years?
So, I mean, there are a number of these very good initiatives. We have just started the process of starting a new School of Public Health.
Oh, okay.
Yes. So that will be one of the great additions to our medical. As you know, our medical school is one of the largest in the country.
Yes.
40% of all physicians in Michigan have had some relationship with School of Medicine at Wayne State University.
Yes.
So that is a very, very good new initiative in terms of we're also working with Carmanos, a cancer institute, so we're going to be starting a new building there, probably a new hospital, which caters to the health, and the education process of our medical students and doctors. Law school, we have numerous new initiatives. We have started a minor in law. So in the undergraduates, and that's a great opportunity for those who might want to go into the legal system or into finance, et cetera, because
Yes.
law is very essential in every aspect of life.
Right.
So having a minor in law, which I think only 2 or 3 universities have.
I've never heard of
It's
that.
a great opportunity.
It's very good.
Very good opportunity. And we're trying to get kind of inroads into interconnectivity, like law with the minor law with other fields.
Yeah.
At the same time, we will have, say, for example, how physicians can understand the patent laws.
Right.
So we will be probably, it hasn't started yet, but we talk about how do physicians get to know the patent law or even be able to patent as patent agents, because you don't need a law degree for that.
Right.
And so those are things in the process of discussion rather than anything more. As far as medical school is concerned, we are the ones that have looked into There was a program for accelerated medical school.
Yes.
Especially for minorities. I mean, there are so many kids from inner city schools, from Detroit and others, that we put them into medical school, start off as an accelerated program. So that we are reviewing as to how to streamline it more. And our nursing nursing school is one of the top in the country too. By the way, Wayne State has 2 accolades now. One, it is in the 1.6% of the top universities in the world.
Impressive.
Okay?
Yes.
That's 1.6 in the world.
Yes.
And number 2, we are the second best urban research universities in the country.
Wow. Okay.
So these are great things that keep us busy, and I am really very proud of our law school too, because I know you're a lawyer. You would be actually Dana Nessel, one of our Attorney General. She's from Wayne State, and
Yes.
she would call it the Harvard of Michigan.
What about the Illich School of Business? I was reading about that too.
It is coming up.
Yeah, it's coming.
We're fine-tuning it.
Yeah.
A lot of work to be done yet. But that'll be one of the very good schools for business.
Yes, very
Fantastic.
well-funded and going to bring in a lot of, it's going to be a very good resource for us, yes.
And especially for inner city.
Mm-hmm.
And our focus is to really, serve all Michiganders.
Yeah.
But how do we get the inner city urban school kids to come to Wayne State or to get further educated and go up the social ladder and economic ladder? So that's our mission. A lot of stuff to go on.
Well, I guess I should ask you about free speech, because that seems to be one of the major issues plaguing universities throughout the country. And, universities have always been the bastion of free speech, from Vietnam to civil rights, and now the conflict in Israel. So can you tell us what's happening at Wayne State?
Oh, Wayne State has done it, I think, the best way we can and could have and should.
Yeah.
We are the bastions of free speech, without doubt. We are there to facilitate people's conversations, however contradictory or however controversial it may be. We have the platform. So we look at Wayne State as an educational entity that gives you the platform for intellectual growth by discussion and discourse. But at the same time, we are not, as a board and as a university, we do not want to be involved in your activism. We give you the platform, but we do not want to be part of your program. Individually we could, but as a university, our purpose is education and to make sure that there is growth, intellectual growth and discussion. And free speech, there is no substitute. However, free speech should also not come at the price of inconveniencing or obstructing other people from their human rights. So that's the balance that we have struck. And it is a difficult tightrope to walk. But I think we have done fairly well, because we are making sure that we have discussions with the groups of people that were the protesters.
Yes.
We kept our doors open for conversation, and we will continue to do that. But there is, in discussion, Encampment and others, because we do not only feel, we do find that we give people the right to protest and say what they want to say, but encampment is a legal and healthcare risk.
And why don't you tell the audience, when you say encampment, you mean what?
So with encampment means they set up tents,
right,
and they set up their pretty much living in the area of your university.
Right.
And for us, it is like, what is the need for it? You can come whatever time that is. You can walk around. You can come and tell us you want to have space or time for discussion. You want to hold seminars, conferences. We are happy to have that. But with encampment comes the risk of healthcare issues and legal issues.
Yes, crime.
Mm-hmm. And a lot of the protesters are not even students. So then you want to make sure that you are not encroaching upon other people's risks that the university is going to take. So, for example, if something happens in an encampment, the university is still liable because it's your land.
Right.
Right? Why did you not provide enough security? Why did you not have this? Why didn't you call? Why did your police force not come in time? We do not want to take that risk because we believe in first right to speech, but we also believe in protection of the other people.
And it is a tightrope because, well, it is a tightrope. It's difficult for me to see how encampment equals free speech. I think it's
That is correct.
two totally different issues, but I guess if you're in the thick of it protesting your issues, you blend them.
You do, but we say, our doors are open.
Yeah.
You can come and knock doors anytime. Tell us when you want to have a procession, when you want to talk to us, when you want stage time. We're happy to give you everything.
So what is the process for the students to organize a protest at Wayne State, for example?
So they can approach us and say, we would like to attend your board meeting, for example, is one of them.
Oh, okay. So when you say approach us, you mean approach the Board of Governors?
Board of Governors,
Okay.
or also if they want to, in the university, address other students, then we can give them platform saying, okay, fine, you want to talk about the Gaza issue, you can have speakers. Actually, we had a great conference on free speech itself, and we're going to continue to have more of these debates and discourses on different topics. So absolutely free to talk both points of view.
Yeah.
So it's not like only one selected. If somebody else wants to give counterpoint, be our guest.
Right.
But as a university, we don't want to be involved ourselves on one side or the other.
Of course, but there's a process and a platform for anybody who's interested in expressing whatever their view is on the Gaza issue or really any issue. And the mechanism is they have to really approach somebody at Wayne State,
And we do have
you'll
people.
give them the facilities and the audience there, or maybe not the audience, but you'll make it happen,
Right.
in a lawful and peaceful way.
Exactly.
Yes.
And our president is very good. She
Yeah.
has, opened her doors to saying anytime you want, we're happy to have your meetings. But again, people get very, very unidimensional. They want one point of view only.
Yeah.
And we will still listen to that. But for us to do what the one side wants us to do may not happen. But we're really ready to talk to them about that ad nauseum.
Right.
Yes.
Is free speech the biggest issue facing higher education right now, or is there something else that I'm not cluing into?
Well, free speech is only one of those that
Free speech is what we're reading about, I guess.
Higher education, in my mind, needs an overhaul. Okay? So, I was born and brought up in India, and then I went to Belgium for about 6 months or 8 months for research. Then I spent 5 years in England, and then I came to America. So I have an idea of the differences in the educational processes around the world.
Mm-hmm.
I think our education, higher education, is less focused on careers. And personally, I think a lot of the resources, both financial and temporal, meaning time lost by students, in trying to follow an age-old process of 4 years college and then into graduate school.
Mm-hmm.
In England, in India, I went to medical school soon after my 12th grade. Did I feel inability to learn medicine? No, because they taught us what we needed to know, and I think I have practiced medicine well. Same thing in England. You do your 12th grade or whatever they call it is, and then you go to medical school or law school. So it saves a lot of people from getting a lot of debt.
Yes.
Because after all, in England it's free. In India, it's very, very economical. But here our kids are undergoing a lot of debt for education they may not necessarily be of that great help for the purpose of what they want to have as a career. And I think we should need to really, as adults, look into it and say, okay, is our system, which is 100 years old, really worth reform or not?
Well, the fact that our biggest state school, University of Michigan, is $50,000 a year for room and
Yes.
board. That's already cost prohibitive for most of the state of Michigan. So I completely agree with you.
Although I do have a great idea to make education debt-free. Not only education, even skills training.
Let's hear it.
And okay, so this is what I planned when I was running, and if I run again, it'll be the same platform. So I think the best way to overcome this issue is to be able to give tax credits after you start working. So, for example, you went to medical school or law school and you got $200,000 as your debt.
Right.
I went to become a welder, so it's not just going
Yes.
to college. I went to a welding school, took $50,000 loans, and I became a welder. And so then what happens is, then as soon as I start working, $50,000 would be my tax credit. For you, $100,000 would be your tax credit. Well, you're going to pay it off in 5 years because you got your money back.
Yeah.
And the country benefits because I would have been flipping burgers, but now I've become a welder.
Yes.
Not only that, I became a welder, and I say, you know what? I want to do underwater welding. And so I go take another $100,000 and I become an underwater welder. And now I'm making $150,000 to $200,000. But for 35 years or 30 years after that, I'll be paying taxes at that level. So you retrieve. It's the same principle that we sometimes talk about, especially that decreasing taxes helps people, helps the country. And I mean, it's a phenomenon that I still can't understand because I'm still in the idea of saying, hey, more taxes will pay more bills.
Right.
But it does work. And similarly, this would help because it would take away the fear in anybody's heart. Saying, I know my PA, he's a great physician assistant. He would have been a great doctor, but did not have the money to go to medical school.
Right.
This would allow him to say, fine, I'm getting the loan, I'll take my this, as soon as I get my tax credit back. I'm not paid a dime for my education, but the country benefits.
Yes.
The whole platform of kids wanting to do better changes. So that's one of the ideas. To whoever I've talked, it seems like a logical idea, but we'll work it. But
Well, I'd like to. I like the idea, and I'd love to see you
Well,
run again.
Thank you. Thank you.
Anil, I have to say, you don't often meet doctors who are so focused on policy and education and public service. So I appreciate everything you've done for the community.
Oh, thank you.
I greatly appreciate everything you're doing,
Thank you.
at Wayne State University, and I'm grateful for your time this morning.
Well, thank
and I hope you come back again.
Well, thank you so much. It's always a great pleasure. It's great to know you.
Yes.
I'm sure I'll come back again if you invite me.
Thank you so much.
Thank you so much.
And audience, thank you for tuning in to APN Play. We'll see you next time.